So now we are going to look at the topic that is SLE, systemic lupus erythematosus. The word SLE, systemic lupus erythematosus, is autoimmune disease. This is autoimmune condition in which immune system attacks on its own organs, multiple organs, that leads to various systemic involvement, like skin is involved, kidneys are involved, brain, joints are involved, and that leads to a problematic condition that is known as SLE, systemic lupus erythematosus. So what happens? There are certain hormones or medications or environmental factors that lead to systemic lupus erythematosus, and sometimes genetical predisposition is there, which leads to patient having butterfly rash around the nose and cheeks. Joint pain will be there, serositis, oral mucosal involvement, skin pigmentation, face, cheeks involved, and it is a patient have fever, myalgia, muscle pain, hair loss, with other symptoms like mouth ulcers, blisters, and these conditions, complaints will be there in the patient. So how can we diagnose? We will perform a test of ANA, CBC, X-ray, liver function test, and urine analysis for rule out, and other antibody tests are also done to rule out the disease. How can we treat the condition? For treatment, we have to give NSAIDs, anti-inflammatory drugs like hydrochloroquine and methotrexate, sometimes medications to treat the symptoms of systemic lupus erythematosus. And we have to counsel the patient about disease, and we have to tell the patient about the outcomes and certain medications knowledge to the patient in order to treat this disease in the proper manner. So in this way we can treat the condition known as systemic lupus erythematosus.